A concussion is caused by either a blow, a jolt, a bump, or being struck with an object to the head. So with concussions, it affects the brain. It can cause some swelling, could cause hematoma on the brain, or bleeding. So those are some of the effects that it can have on the brain. According to the American Association of Neurological Surgeons, sports play a major role in traumatic brain injuries and in concussions. So it says that according to the U.S. hospital emergency rooms in 2009, it says that the following were the highest reason for concussions and traumatic brain injuries, and that is cycling is the highest with a count of 85,389 people, followed by football, which is 46,948. So those are some of the highest instances of traumatic brain injury or head injuries treated in 2009. So that is just kind of a look into how many, according to the American Association of Neurosurgeons. So with concussions or traumatic brain injuries, sports, do play a major role. And it is said that kids are playing more contact sports now, and they are starting sports at a younger age, so that really poses more of a chance of having a concussion or a head-related injury. Now I do feel like with that we do need to have stricter guidelines on concussion and post-concussion symptoms and checkers, and making sure that people are followed by a physician after concussions, that coaches are not just sending players back out on the field after head injuries. And I feel like not that kids shouldn't be able to play sports, just because I do believe sports have a very positive impact on children and children's lives, but that you definitely do need to have more of a mandated or more of a strict policy as far as making sure that those kids are cared for correctly if a head injury does happen to occur. It talks about some of the long-term effects. So chronic traumatic encephalopathy, and according to the Boston University Research Center, it says the only way that you can actually diagnose someone with CTE is by post-mortem, so after they're dead. It's not something that can be detected on MRI. Now with this, this is found in people with a history of repetitive brain trauma, and it says, often it is athletes, so including, that they did have some symptoms with concussions, as well as, not having symptoms. Sometimes you do not have clear symptoms with concussions, which is, a reason that we need to be closer evaluating people in contact sports, athletes, things like that. With this, some of the symptoms of having CTE includes memory loss, confusion, impaired judgment, impulse control problems. So you could see a difference in their personality, their control. You could see some aggression issues, increased depression, anxiety, suicidal thoughts, and then also progressive dementia. So it says that these symptoms are often begin years or even decades after the last brain trauma, or after they end their athletic involvement. So you are seeing these effects far down the road. And with that, that would be a reason, maybe not to have children start contact sports so early. It really does increase their chances of having CTE further down the road.